Good morning. Thank you very much for the invitation to this exciting conference. I find it very interesting. And I'm going to talk about the implementation of evidence-based practice or research-based practice in Norway and embed it in a project that we have developed in Norway over the last 14 years. So I'll try to make some comparisons or elaborate a bit on the practical pros and cons. And of course, some outcomes, some experiences are rather positive, some are not so positive. So we still have challenges. At the turn of the century, I was with my colleagues looking for a school model and how we should change staff practices in schools in order to prevent and reduce problem behavior, because that's a task of our center. This is to prevent and reduce behavior problems among children and youth, and also increase social competence and academic achievement. So we went looking, and we went to the University of Oregon, and there we met with Rob Horner, George Sugai, and later with Hill Walker and Jeffrey Sprague, who all have been working on what they call the positive behavior support model, a school-wide model. And this model had some of the components we found by looking at mental health models in schools, prevention models, and very briefly, some of the bullet points here. We wanted it to be school-wide, or whole school approach. It should be based on evidence-based interventions or components. It should be skills-based, should have practical consequences. It should be positive behavior support. You should praise children more than you put them down. It should emphasize implementation quality or intervention fidelity. We wanted it to be a team-based approach. Schools are large and complicated organizations. You have to have some infrastructure in order to develop the learning climate and the social climate. And then we saw that we needed differentiated interventions. Some interventions may be universal for all children. They are preventive in the broadest sense. And then we have some children who need a bit more. And then we have students that need very intensive, comprehensive interventions. And we found most of it in this school-wide positive behavior support model. And we tried to adapt it to Norwegian conditions or context, because there are differences, of course, at the society level and school level in our two countries. And we wanted to study it in a randomized controlled trial that turned out to be a bit idealistic, so it didn't turn out so well. I'll come back to that. But in my opinion and my colleagues' opinion, there are no alternatives to RCTs when it comes to the question of causality. RCTs aren't good for everything. Other kinds of research are very useful, contributes enormously, but on the question of causality, does it work, then RCT is the method of choice. And I work at the center, and our task, our goal, has been to develop programs, interventions for children with serious behavior problems or conduct problems or antisocial behavior. And most of our intervention has been implemented in child welfare services and child and adolescent psychiatric services. So school hasn't been the broadest field of intervention for us. This is an overview of the methods, and I'm not going to talk about them, but we have implemented these programs, and most of them are branded, as you know, and been quite controversial in Norway, as in other countries, with multi-systemic therapy, parent management training, early intervention for children at risk, programs for minority children, for drug-abusing adolescents, and also multidimensional treatment foster care, or foster care as it's called, and now this MATCH, which is a multimodal approach to the treatment of both anxiety, conduct problems, and depression. So this is, in a way, our main line of work. But then we had Pulse, which was our school model, and brings me back then to the school-wide positive behavior support model. We tried to adapt it to Norwegian conditions in order to fit all students, to be an inclusive model, to reduce or prevent problems among children, to increase school outcomes for all children, improve the learning climate, increase the use of evidence-based practices, and we call this then Pulse, which is a school-wide positive behavior support model. And we started implementing this model in 2002, and by now 215 Norwegian schools have implemented the model, and most of them are still running. And of course, I can't go through the whole model with you. That would take me about 2-3 hours, but just briefly mention that we wanted some intervention to target all kids in school. Give them some backup, some signals that you're doing well. So we had procedures for encouragement of positive behavior, we had proactive classroom management, and we had universal social skills training in these schools. So this was interventions for all children. For those who were at moderate risk, we increased mostly with the use of small group instruction, either in reading or in social skills training. We increased the support of their parents, and we increased the support of the students. And of course, for those with most serious problems, we had what we call indicated intervention. They are individual, they are intensive, and they're targeted then in special plans for intervention. And we also recommend that the parents of these children should receive parent training, so they can get some support in handling the kids at home. And simultaneously, the teachers could get some supervision and advice on how to tackle these children in daily life in school. So in a way, that's very briefly as a synopsis of the model. And of course, you need handbooks, you need instructions. So we've written books, so everyone in Norway may read about what Pulse is all about. It's quite open. You can buy it in bookstores, and even had a Danish translation of this book, because Pulse has also been tried out in Denmark. But more specifically in the training, we develop manuals, handbooks, so they see very concretely how should the model be practiced, how should you put different interventions into practice, and we made some DVDs, presentation of the model, and some ideas about how to tackle problem situation, or how to organize play in the free time, and so forth. We had an implementation strategy. And first of all, we required 80% of the staff to say, we want to go on board this model. So if schools weren't motivated, and they filled out forms individually, and we collected them and see, is there an 80% interest in this school to implement? Because it's a lot of work. It's a complicated, comprehensive model. So we needed 80% on board. And we said, you have to marry with this project for 3 to 5 years. Probably more. So, schools have a lot of activities, and we try to commit them to working with this model over time and promise some good results. And we had a team-based approach. So every school established a team with the principal, teachers, staff, school psychologists, and parent representatives. And their job was to plan, inform, train, implement, monitor, and evaluate interventions. So they're, in a way, the driving wheel in this model at each school. And then we had specifically trained PALS supervisors who worked with the schools then, and were trained by us at the center. And then we were very concerned about what Dean Fixen has called data-based decisions. So we institute several feedback systems in these schools in order to monitor how they progress and how they solve the different problems. Use standardized assessment instruments, one called school-wide information system, But the whole idea was then to keep the program on track without having it diluted. And every year, all teachers in all schools, they fill out a form called the SAS, Self-Assessment Survey, in order to see have the different components, routines of the PALS model been implemented at your school. So we ask each teacher, and we collect them, and we see, is there a support for the good implementation of the model in the schools. And we found out after 3 years, 75% of the schools had implemented model with quality. So the universal interventions were less of a problem. That was classroom management, social skills training, teaching rules, having positive behavior support. But the more intensive interventions for children at risk or at high risk was more difficult. So we see we need more than 3 years to have them implemented. Even these schools worked very well, worked hard on implementing the model, but they took time to establish these routines, small group instructions, and intensive interventions for those with the highest problems. So we say now we may probably need about 5 years to have the whole model implemented. So that's quite a time span then. And back to the evaluation design. As I said, RCTs are the best way of drawing conclusion about the consequences of plan change. And whenever feasible, that's my attitude and the attitude of my colleagues, whenever possible, we should use RCTs. And we use the most of the other programs, but we encountered some problems with Norwegian schools. We approached about 90 schools, and only 12 said they would participate in an RCT. No one wanted to be control schools. No one wanted to be comparison schools. And they were quite insistent. Today, maybe I haven't given up so easy. Would we back down? So we said, okay, let's see if we can find an alternative. And of course, I won't go into the details, but we have to do some design consideration. And we ended up with what we call a non-equivalent comparison group design. And that's design procedures or design planning with the goal of making the two groups as comparable as possible, matching on relevant variables, even if we could randomize. So we can see that the intervention schools and the comparison schools were comparable. So we put a lot of work into developing the process measures. We had multiple assessment points. We tried to minimize program contamination by keeping the intervention schools and the control separated, never in the same municipality, so they shouldn't be able to talk together. And then we had multiple informant groups. So, and we also wrote about this in the article here about the design. And of course, it was a large project. I will never do it again. One time is enough in a lifetime. We included in this evaluation study 65 schools, 12,000 students at 6 time points, 3,700 staff, and 2,750 parents. So it's a huge amount of data in this project. And here's the timeline. It almost wore us out, and also the schools. So we had a double baseline. We evaluated the baseline characteristics, and then we evaluated at the end of year 2 and 3, and then we had a follow-up study of all the schools. So it's quite ambitious and quite a lot of work to do. And we started publishing on the outcomes. And we always start with publishing the outcomes in international journals, and then make reports or disseminate to the Norwegian practitioners. But we think it's very important for the credibility of the model that we have good replication studies that show that this really works, and it's been in peer-reviewed journals, because all our programs, including PALS, have been met with the comments in Norway, works in the United States, States doesn't work here. Almost like Trump. Preliminary outcomes, we haven't analyzed all the data yet. As you can see, there's a huge amount of data to be analyzed. So even if we have multi-informant groups in the study, we have mostly concentrated on the psychosocial outcomes from the teachers and from the students. So we have prioritized them. And the parent evaluations and the academic achievements of the students remains to be analyzed and published, of course. And also what we consider very important, the relationship between fidelity or implementation quality and student outcomes also remains to be analyzed. But so far, we saw that after 1 year of implementation, only one outcome was positive in favor of the PALS school. So change came slowly in these schools. But after 3 years, we had a significant reduction in problem behavior outside classrooms. We have a better learning climate. We have significant higher collective efficacy in the schools. That, I think, is a very good measure of school-wide implementation. We had a significant difference in self-efficacy of the teachers. We had a significant increase in positive behavior support, and we had significant reductions in negative behavior corrections in the schools. So after 3 years, the outcomes started to improve. But, and that's been serious consideration, we had no significant outcomes on student variables. So when we ask them about classroom climate, positive behavior correction, they say or their responses then, or their assessments show no difference after 3 years. So that gave us something to think about. And two things come up. One thing is that most studies of schools show that the correlation between teacher assessment and student assessment are rather low, rather modest, as when you compare teachers and parents. And the other thing is an almost universal tendency in schools for children over the years, as they move through the school system, become less motivated and report less well-being. So in a way, there's something that tired them out in school. So that may have impacted our outcomes as well over 3 years. But of course, other explanations be there's maybe a positive response bias by teachers. And of course, we had more uniform school rules, consequent disciplinary practices, and I'm not sure all students like that. That they would like to have some more leeway, some more freedom to do whatever they like. So maybe they felt that this was a more effective control. And particularly the girls weren't so happy about the way things changed. And of course, there are also measurements problems. For instance, we asked students in 3rd grade, how many times were you praised by your teacher the last 30 days? I can't understand why we could ask them in such a way. So I think we have to find a more wise way to ask the students about how they experience the interventions. So, but gives us something to think about. So we don't take completely off, but how to reconsider then how should we look at the student perspectives. A small but important change was in the amount of inclusion. So we saw in the PALS schools, the number of students excluded went down from 56 to 35. That's a reduction of 37%, while it increased with almost 54% in the comparison schools. And even these are small numbers, but because in Norway we don't usually segregate students at this level of school, but it's an indication that the PALS school were very concerned about delivering an inclusive model for the students. And then we looked at what characterized schools with high versus low implementation quality. Which schools were able to implement the model with fidelity? And first of all, small and middle school of middle size manage better than large schools. So we have to think about some refinements about our large schools, and that was mostly schools with more than 400 students. We also saw that the higher the percentage of trained staff, the better the implementation, so it's about professional quality or training. But to the extent that they have a large amount of percentage of immigrant students, it was more difficult to get the model working. And also the percentage of problem students made it difficult to implement the model. So I think we have an ideal model, but some challenges also challenge the implementation. So it's difficult, to implement the qualities, the procedures, the routines. If you have many problem students, many immigrant students, if you're in a large school and you have a lot of untrained staff. And that is a signal to us. We have to differentiate the model to schools of different characteristics. And of course, one of the main take-home messages from this project, I think, is the importance of implementation quality. That no matter how good the training is, how good the aims are, the good routines are, you have to evaluate practice to see, do they really implement the model as it was planned, as it was intended, or does something happen to the model on the way? So in order to maintain the purity of the model, we had to measure and monitor implementation quality. Because, as you are very well aware of, many competing forces will dilute, defocus, and devalue the original model. As soon as you introduce a new model in school, they start to transform it. They say, that's too difficult, that takes too much time. We don't like that. So in a way, to keep track of the original model is a challenge. And there, I think we shouldn't always be on the service side, always saying, what do you want, what do you like, what do you need, but also emphasize on what we call iron control. And we have some core components, so we say you can't touch them. You can't touch the core components. And we use an expression that we call the zone of drastic mutation. You may have flexibility within fidelity, but there is a zone of drastic mutation which change so much of the model that it probably won't work. And that's the task, and that's a responsibility of the implementation team or the program developers. That is to keep track of the core elements. So we had to know when to be rigid and when to be flexible. And that's the kind of, I would say, implementation wisdom. Last, closing off with, I think, as you may see from this model, that we need evidence-based practice in child welfare, in mental health, and also in schools and preschools. And as regards schools, I think it's a paradox that this primary educational institution in our society doesn't build its own practice on research. And so much on ideology, so much on tradition, so much on delivering old myths, or maybe good advice to new students. So I think have a commitment here to have it more research-based. And this is, of course, as Brent mentioned, I think by Camilla yesterday, the Hargreaves lecture, no, this person before you, that evidence-based practice may turn teaching into a research-based profession and strengthen their professional role, their self-efficacy, and their reputation. And of course, I think researchers and practitioners should converge in their perspectives. It shouldn't be that research says one thing, experience say another thing. It should, I think, at some point be able to converge and say there should be one of the same. So when practitioners say this works, that the researchers could go in and test it and say, yes, we find that it works. So I think we'll come there sometimes. And of course, there is a limitation on autonomy. And that's been maybe the main argument against this kind of practice in Norway, that we reduce professional autonomy, that we reduce teachers' freedom of method choice. And we think that, yes, there should be freedom of choice, but you should choose between evidence-based methods or methods that have documented that they actually work.